Hey guys, if I look a little ragged and tired, it's because I have been trying to use a PowerPoint presentation I made and do some screen sharing on YouTube, and it has just not worked out the way I wanted to. So now I'm back to videoing myself. And my name is Christy Martell. Again, I'm not a fan of making videos of myself, so I did an elaborate PowerPoint presentation, but getting it to screen share today is not working out. So I've just scratched that. I'm going just to make the video of myself so that I can get done and I guess read you my PowerPoint as I do so. Our first question was to define psychopathology versus normal mental functioning. What is normal? Patterns of thoughts, behaviors, feelings that conform to the usual, typical, or expected standard. Usual and typical and expected standards, that depends on what one's approach to normality is. In my PowerPoint presentation, I had a little picture, and it talked about that normal was just a setting on the washing machine and the dryer. That was something that I learned when I was in substance abuse treatment, because we talked about that there were really no normal people, but in this sense of the realm there is, but I just thought it was entertaining, so I'm sorry that you're not getting to see it. I really put a lot of work in this PowerPoint presentation. Abnormal is patterns of thoughts, feelings, or behavior that is deviant, distressing, or dysfunctional. Psychopathology is, I went too far, is the study of mental disorders. A mental disorder is a group of symptoms that cause distress or significant impairment. The symptoms can be emotional, cognitive, or behavioral. In other words, mental disorders involve significant problems in one or more areas of psychological functioning. So what's the first step in helping someone who comes to you with mental health concerns? I believe it's always to listen to that person, listen to them respectfully, realize the value and the importance of that person. Don't diagnose someone first and then ask questions to support this clinical picture that you've made. Identify the reason for the referral and the events leading up to the referral. Also, thinking about the person and the environment, and getting past history for them. Just doing a thorough assessment. The first step, I believe, is always just listening respectfully and valuing that person. And I also think it depends on where you work, if you're able to diagnose. When I worked at a substance abuse treatment center, the therapist did diagnose, and then the LPC signed off on all the assessments. I know in some agencies you're not able to. I think it's where it has a lot to do with where you work and the environment that you're into. So, what are the key criteria to determine the presence of a mental disorder? The DSM is a central element of the debate around defining normality, and it continues to change and evolve. Currently, in the DSM-5, abnormal behavior is generally defined as behavior that violates a norm in society. It's maladaptive and is rare, given the context of the culture and environment, and causing the person distress in their daily life. So I wanted to break down, I'm going to have to stop and get something to drink. I am so sorry. But like I said, I've done this so many times. I broke down deviance from the norm, maladaptive, and experience of personal distress, and gave a little definition of those. Deviance from the norm is thoughts, feelings, and behaviors that are considered deviant when they differ so markedly from social or cultural norms that it can be reasonably considered inappropriate or unacceptable. In other words, the intensity is so high or low, or they occur so much or less often than in the majority of the people. Maladaptive emotions, thoughts, and behaviors are those that interfere with a person's typical functioning, including the ability to care for oneself, having good relationships with others, and functioning well at school or at work. Experience of personal distress occurs when a person is concerned or upset or otherwise bothered by his or her own emotions, thoughts, or behaviors. What purpose does making a diagnosis serve? Specific diagnoses can help people identify empirically supported treatments that have a good track record for symptom reduction and decreased pain. It helps people to feel understood and not feel crazy. A sense of relief of being helped by a professional. Being understood helps reduce anxiety and helps people feel connected and hopeful. If you meet criteria for a diagnosis, it could be argued that your treatment, is medically necessary, and thus it helps qualify for insurance reimbursement purposes, which alleviates some stress. Are there disadvantages to labeling on giving a diagnosis? Sure. There are stigmas attached to having a psychiatric disorder. The label itself becomes like a self-fulfilling prophecy and can bias the way that clinicians and the public see the person. Even the patient themselves can fall into the trap of behaving the way that they think that they should, especially around clinical people. Different interviews with different clinicians could not yield the same results. I could do an assessment and someone else could do assessment 3 weeks later, and they could have different results. There's ways to help improve that process, using screening like the Beck Depression inventory, craft screenings, those kind of screenings. These can help cut down on the changes that you see between clinicians, but they also take a lot of extra time. Explain how you as a social worker diagnosing could become aware of culture in the diagnostic process so that you can overcome biases. Being culturally competent cannot be overstressed enough in the social work field. We have a great opportunity with the internet to research, to learn, asking questions once you get a relationship with your clients and you establish rapport. They can teach you a lot of things. I've had a lot of clients that would teach me about their cultures. I've had adolescents that would teach me about gang-related activities and gang rules and taught me a lot. And it can be a way that you learn more about them, and it also helps you at the same time. But when they start talking about something that they're familiar with, their comfort level goes up, and and they let their guard down. The DSM-5 has a separate section in the back of the book titled Cultural Formulation, and includes a cultural formulation interview to use during your assessments. I did not know that. I found that very interesting. I think there was two, one that you could use with a client, one you could use with someone other than the client to get information about the client. They gave you, I think, like 12 or 16 questions to ask, and kind of told you how to ask them. So it would be a good tool. Also in the DSM-5, there's a glossary of cultural concepts of distress, learning about different cultures and what some of the illnesses that they say, or some of the concepts of distress they have, what they say about nervous habits. I found it fascinating. I couldn't pronounce any of the concepts that they have to tell you about them, but if you haven't already, looking in the back of the DSM-5 would be really good. And then I had a little reference slide. All of the information comes from textbooks, the DSM, the videos that we're given, and our module readings. Again, I'm sorry if I wasn't as energetic as I should be. I'm not comfortable videoing myself very much, and kind of disheartened that my little PowerPoint didn't work. But I'm going to do what I've got to do to get my grades, and to do what we're asked to do, even if I'm not a fan, stepping out of our comfort zone. So thank you for listening, and I hope all of you have a good day.